Hello and welcome to UK Fitness Hub. My name's Travis Tarrant, and in today's video we're going to be looking at the contentious topics of gluteal amnesia and dead butt syndrome. We're going to be looking at what they are, then looking at what the glutes do, how I would test if somebody's glutes were firing correctly or not, and then finally what exercises you can do to start trying to get both or one of your glutes firing correctly. Let's get into it. If you've looked online at what gluteal amnesia and what dead butt syndrome actually mean, you've probably been left feeling quite lost, and this is because there's a whole host of different definitions when you go from one article to the next and one website to the next. So after a brief little look myself, here's what I found, and these are all off websites and definitions of these terms. When the glutes aren't firing at all, when the gluteus medius or gluteus maximus isn't firing, so just one of the gluteal muscles, when the glutes aren't firing during exercise, when after long excessive periods of sitting, the glutes have become inactive, so somebody's sat down for so long that when they've come up, the glutes aren't working, they've become inactive, maybe people that work at a desk all day, for example. And then finally, you've got nerve damage to the nerves that supply and innervate the gluteal muscles. So these are the superior and inferior gluteal nerves, and these have been damaged. There's been some kind of trauma to these, and as a result, it's inhibiting muscular contraction. So I can understand why somebody straight away would feel really confused when they're seeing all of these blanket terms that are described as gluteal amnesia and dead butt syndrome. So let's look at some of those definitions. The first one being that the glutes aren't working at all. So let's test that out. I'm currently in a seated position, which means that I'm partially flexed at the hip. Now, if I want to come up to a standing position, it's going to require hip extension, and that's the main function of the gluteus maximus muscle. So for me to do this, if I can do that movement, the chances are that the gluteus maximus is just fine and it's kicking in and working for me to do that movement. For argument's sake, let's say somebody says, okay, that's the gluteus maximus, but what about the gluteus medius and minimus? If this skeleton was to go and balance just on its left leg, what's going to happen is the pelvis has to be stabilized to be able to keep a neutral position, nice and straight. If it wasn't stabilized, this hip would drop down. The whole responsibility of the gluteus medius and minimus is for pelvic stabilization. So when we come onto one foot, the gluteus minimus and medius on this side would contract to make sure the pelvis is level. So we can test out if they're working by going onto one leg and seeing how the position of the pelvis is affected. If it completely dropped on the side that you've taken off the floor, so in this case the right hand side down, that would be an indication that they're not working or not firing correctly. And if it was a completely neutral pelvis, that would mean that they're working well, absolutely fine. Then the next definition was nerve damage to either the superior or inferior gluteal nerve. So if somebody had nerve damage, what you might tend to find is they get numbness and tingling in the affected side. They might get sharp electrical impulse pain down the leg, and they might also find it really uncomfortable to sit because we sit on our glutes. So this position might be really, really uncomfortable. So if that doesn't sound like you, then the chances are that you don't have nerve damage. But if you do suspect it, please do go and see a doctor or a GP. The next one was that the glutes are working, so they can stabilize the leg, they can extend the hip, but they're not firing during exercise. So other muscles are taking over. So for example, the quadriceps or the hip flexors, or maybe it's the hamstrings. And what we would do to stop this dominance and start getting the glutes to fire on exercise. And we're going to cover how I would do that a little bit later. One of the other things we're going to cover just before is that there's some things that are linked to gluteal amnesia and dead butt syndrome. And these are things like anterior pelvic tilts, where the pelvis is tilted forwards. Another thing is things like lower back pain, hip pain, dominance of those kind of hamstring, quadricep and hip flexor muscles. So those types of things would be things that would be associated with dead butt syndrome and gluteal amnesia. So the first thing we're going to do is we're going to look at what the glutes actually do in their primary functions, and then we're going to go on to actually looking at how I would assess if somebody's glutes were firing properly. First, let's look at the Gluteus Maximus. As the name suggests, the Gluteus Maximus is the largest muscle of the three gluteal muscles. It's coarsely fibred and is the heaviest muscle in the body. Its main function is hip extension. We extend the hip from a partially flexed position when we get out of a chair. Other muscle actions include abduction of the thigh, so bringing the thigh further away from the midline of the body, and lateral rotation of the hip and stabilization of the hip joint. Next up, we have the gluteus medius and minimus. Medius meaning middle in Latin, and minimus meaning the smallest. The gluteus medius is mostly deep to, and therefore obscured by, the gluteus maximus, whereas the gluteus minimus is situated in front and below of the gluteus medius, whose fibers obscure it. The main function of the medius and minimus are to abduct the thigh at the hip joint and also to medially rotate the thigh. As mentioned earlier, one of the crucial roles the gluteus minimus and medius play are to hold the pelvis in a level position, especially when we bring one leg off the floor. Here, I'm lifting my right leg off the floor, so my left gluteus minimus and medius are contracting to keep my pelvis level. If these muscles weren't working, this would happen. My hips would drop and sag. Now I'm in a position where I'm unable to put my foot back to the floor. In the UK, we tend not to use the terms gluteal amnesia or dead butt syndrome. They're more American-based terms, but what we do use is the term gluteal misfiring. So this is when the glutes either fire late or in the incorrect sequence. And this can happen for a variety of different reasons. So for example, lower back pain, tight hip flexors and overactive hip flexors, a tight lower back, dominant hamstrings and quadricep muscles, as well as a lack of muscular recruitment from the glute muscles themselves. So an example would be, when we looked earlier at those muscular functions, that's what the glutes, the individual glutes, should provide the body. But let's say in hip abduction, for example, when we bring the leg further away from the midline of the body, that all we feel is hip flexors and no glute contraction at all, then there's a chance that we could have misfiring glutes or a faulty firing pattern. So let's look now at how we would test out the firing pattern of the glutes, and then look at exercises to develop the muscular recruitment of the glute muscles themselves. Let's get into it. So the first firing pattern I'm going to test for the glutes is hip extension. So I've got the client face down. The arms are at the side of the couch. I don't want them up in the air because I don't want the lats to start engaging. I've got the feet hip width apart and a nice neutral position throughout the body with the head facing forwards. So the first thing I want to test is the glutes and hamstrings. So when the client comes into hip extension, what I want to feel is the hamstrings and glutes, you can relax that there, fire at the same time. So I'm going to get the client to do this 5 times. And as the client's doing this, I'm absorbing the feedback. And already I can tell it's hamstring dominance. The glutes do kick in and contract, but quite late. So this would tell me the hamstrings are dominating the movement. And one more. Good. So that would be phase 1 of what I would test. The second phase is testing the lower back. So if I had a client that was lordotic, so had an anterior pelvic tilt and a lot of curvature in the back, what I can do is I can put a couple of pillows underneath the stomach to make sure that I've got a flat back to work with. So the first thing I'm going to do is just expose the spinal erectors. And now what I want is a firing pattern of these two together, but I know the hamstrings firing first in this sequence, then the contralateral side, which is the opposite side to the leg I'm working, so working the left leg here, so it'll be the right spinal erector, and then I want the ipsilateral side to fire, so 1, 2, 3, 4. So now I know that the hamstring's firing first. Let's see what fires first out of these two. So if we come into hip extension, good, and relax, and 2 more, and last one. So I've got hamstring firing, contralateral side, which is good, ipsilateral side, and now I need to find out if the glutes are firing before the back or after the back. So we're going to go again. Okay, 2 more, and 1 more. Okay, so what I should be getting is 1, 2, or 1, 2, and then contralateral side, ipsilateral. What I'm getting, however, is hamstrings, contralateral, ipsilateral, and then the glute. So how would I get the glute to start firing? So the first thing I want the client to do is to start to squeeze the individual glutes one by one. So this means to squeeze the left glute, then squeeze the right glute, back to left and back to right. This is going to create a mind-muscle connection for the client, and you'll be surprised at how hard this is the first time you do it. So we're going to do 3 sets of 20. So the client's going to do left side, so squeeze for 3 or 4 seconds, then right side, right side. And it's quite hard to disengage one side when you're squeezing just one side. The client's just done 3 sets of 20 repetitions, squeezing one individual glute at a time. And the client's feedback was on the first set, that it was really tricky to be able to squeeze one glute and completely relax the other. And when you try this for yourself, it is surprisingly difficult, because what happens a lot of the time is you try and squeeze one glute and the other one still fires and contracts. But the more you do it, the more sets and repetitions you do, the better you will become at just firing one individual glute. Now what we're going to do is we're going to retrain hip extension. So the first thing I'm going to do is I'm going to place my hand underneath the leg, just on top of the knee. I want the client to squeeze the left hand glute, because that's the side that we're working as hard as possible, and then come up into hip extension. And the client's going to do this 10 times. So that's 1, 2, 3, 4. So the client's relaxing at the bottom, squeezing the glute, and then coming up. Good. If you stop there, what we can also do is I can place my thumb, I can press it into the glute, and when the client tries now, it's going to be harder for the glute. So the glute has to work and contract much harder now that I'm pressing my thumb in. 3 more. And I'm engaging much more of a response now. And last one. Good job. So what I can also do is, if I felt that there was too much hamstring activation, I can place the knee up to a 90-degree angle, and I can start then to get the same extension. That's it. So squeeze the glute, contract, and up, and 3 more. And this just takes a little bit more hamstring out of the movement. Good. And last one. Excellent. So now we're going to go onto the client just trying that hip extension herself. So now we're seeing hamstrings firing, but just after is the glute rather than a delayed response. Really good. 1 more. Fantastic. So now, when I look onto the contralateral and ipsi, erectors. Good. So now we've got a combination of 1, 2, 3 being contralateral and 4 being ipsilateral. So now that's a much better firing pattern than what we first started. We can also test how the glutes fire in hip abduction. So just to remind you, hip abduction is when we bring the leg away from the midline of the body. And the glute firing pattern for this one is the glutes firing first, then the TFL, and then the QL at 25 degrees of abduction. So to start off, I've got the client side lying in a straight position all the way from head to toe. And the first thing I'm going to check is if the QL's firing first. And the giveaway for this one, and you can see it generally just by visually looking, is there's a hip hike and then abduction occurs. And this is quite common with people with a tight back, for example. So I'm going to expose the QL, and I'm going to get the client to fire into abduction. 5 times for me. 2, 3, 4, and 5. Good. So I can tell that the QL is not firing first, and now I'm going to test TFL and glutes. And 5 again for me, nice and slow. 2, 3, 4, 5. So in this case, I've got the glutes clearly firing first, then the TFL, and then I've got the QL firing as we come up higher into the movement. If it was the TFL that was firing first, there's a couple of things we can do to try and encourage the glute to work. So the first thing would be if we bend the bottom leg to take that out of the way, what we can do is we can try and inwardly rotate the tibia. The tibia is your shin bone. So if I bring that in towards the midline of the body, and now we come up into abduction, and we go for 10 reps, 3, 4. I can already feel, in terms of this position, the glute engaging more than the previous straight position. 7, 8, that's it. 9, and last one. 10. So there's a lot more contraction there from the glute. And I could also go one step further and bring the thumb into the glute to make it contract harder. And the other thing that I can do is I can bring the leg into a little bit of extension. I can get the client, like we did earlier, to squeeze the glute as hard as possible. I can keep this leg down and then they come up into abduction. So this would be one where at the bottom they would completely relax, squeeze the glute as hard as possible and then come up and just try and get the glute firing first and try and create that mind-muscle connection. So those are two things that we can do. Now let's look at some exercises that we can progress onto. For the first exercise, we're going to begin to stretch out the hip flexors. Kneel with one knee on the floor and bring your other leg out in front of you with your knee at a 90-degree angle. Keep your back straight and begin to posteriorly tilt your pelvis upwards as you squeeze both glutes. Once you've done this, bring your front knee forwards, keeping a straight back as you do so until you feel a stretch in the hip flexors. Hold this stretched position for 5 seconds before returning back to the start position and repeat for 10 times on each leg, going further into the stretch each time. Throughout the entirety of the 10 repetitions, I'm trying to keep that posterior pelvic tilt and keep my glutes engaged. Stretching out the hip flexor muscles is really important. If you're having trouble firing the glutes, it could well be tight and overactive hip flexors that are inhibiting the glutes. I would recommend doing this on both sides, even if you only have an issue with one side. Next up is clam shells. To start off, I want you to lay on your side with your legs stacked and knees bent. Feel free to use a pillow for your head if this position is uncomfortable on your neck. Now I want you to raise just your upper knee, and as you do so, keep your feet in contact with each other. As you do the movement, I want you to keep your shoulders and pelvis completely square on. Once you feel comfortable with this movement, you can either add a resistance band or do a more advanced movement where you internally rotate the tibia. Earlier on, we spoke about internally rotating the tibia and how to do so. And you can do this with the clamshell exercise, which should recruit more muscular contraction from the gluteus medius and less from the TFL muscle. This may take some practice, but when you get it, you'll know. If you're not getting on with clamshells, you can do a similar movement starting in a seated position on a bench or chair. Start off with your feet wider than shoulder width apart and loop a resistance band just above your knee. Begin to bring your knees further away from the midline of your body and slowly return back to the start position. You can have a play around with different positions, for example, leant forwards, leant back, or in a neutral upright position. See what you feel engages your glutes the most and continue your repetitions in that same position. Whatever variation you do, work up to 20 repetitions for 3 sets. Moving on to exercise number 3, which is hip abduction. Start by laying on your side with your legs and feet stacked together. Again, feel free to use a pillow for neck support should you feel the need to. To begin the exercise, start by raising your leg towards the ceiling. The aim here is to have your leg as straight as possible and to have the position of your heel higher than the position of your toes as you do the exercise. If you're unsure whether the exercise is working or not, I would encourage you to place your hand on the side of your glute and press into your glute ever so slightly as you raise your leg. Can you feel the contraction? If no, try altering the position of your foot behind your body and see if that makes a difference, or try doing a smaller range of motion. You can make this exercise harder by adding ankle weights or a resistance band should you want to. Try to work up to 3 sets of 20 repetitions on both sides. Earlier we spoke about how the gluteus medius and minimus work in medial rotation of the hip, which is what we're going to do for our next exercise. Start off by finding an object that you can place in between your knees. You can use a ball like I am, or a foam roller or firm pillow. Start off by side lying with your knees bent and begin to raise your shin and foot up towards the ceiling. As you do this, your femur, which is your thigh bone, is internally rotating. You should begin to feel your glutes start to fire. If you don't feel anything, you might need to make the exercise harder, and you can do this by placing a resistance band around both of your ankles or using ankle weights. Work up to 15 repetitions on both sides for 3 sets. Something else you spoke about earlier in the video was that the gluteus medius and minimus work to ensure the pelvis stays level when we lift one leg off the floor. Well, for the next exercise, we're going to train the glutes in exactly that function. Find a step and something to grab onto for balance, and then bring one foot off of the step. Allow your hips to drop down to the side that your foot is off the step, then raise your hips up as high as is possible. You should feel the glute on your standing leg begin to fatigue. Make sure that you do the exercise slowly and repeat on both sides for 2 sets of 15 repetitions. If you'd like to start doing heavier exercises than the ones we've covered and really load up the glutes, you can try Bulgarian split squats. Start off by standing approximately 2 feet in front of a bench or sturdy object, with your feet at hip width distance apart, core engaged, and hips and shoulders facing forwards. Take one foot and place it onto the bench behind you. You can either have the foot in a flex position, so your shoelaces are in contact with the bench, or do as I am and have your toes in contact with the bench. Neither is better or worse, it just depends on your ankle mobility. Begin to lean forwards, keeping a straight back as you do so. Slowly lower your back leg down as far as is comfortable, and then return back to the start position. The reason I like to keep a slight lean forward throughout the movement is to allow my hips to flex more, which means when I reach the bottom of the movement, my hips have to extend through a greater range of movement, therefore encouraging maximum glute contraction. This exercise does not just work the glutes, so don't be surprised if you begin to feel it in the quadriceps, hamstrings, or even the calves. You can add weight to this exercise progressively as you become more accustomed to it. Try and aim for 12 repetitions on both sides for 3 sets in total. And that brings us to the end of today's video. Thank you very much for watching and making it this far. It's such a big topic to try and cover and so many different variables that could happen to why glutes aren't firing correctly. So I hope that you've gained some new information and learned something new. And if you have, please leave a like on the video and subscribe to the channel for more free educational content. Of course, if you have any questions or if there's anything I've not covered, anything you're confused about, just drop me a message in the comments box and I'll try and get back to you as soon as possible. You've been watching UK Fitness Hub. My name's Travis Tarrant and I'll see you soon.